Yeah, hi everyone. Welcome to my YouTube channel. Dr. Wan here again to address questions from my follower. I have received so many calls in these last days, and they are all related to diet and weight management. These questions are all coming from patients who are having these medical challenges and they don't know what to do. They've been to some doctors that they keep prescribing them medication to take to manage their situation, and some are able to afford the medication, some are not. Some just don't want to do that. And they have approached me asking if there's anything that I can do to help them in their situation. So that's why I am dedicating this video for them. So here we go. Remember, in one of my videos, I did talk about diabetes, weight management, insulin resistance, and all other related pathology. So I don't want to go back again to say the same thing, but I will just refer you to the other videos I've made in the past. So this one is just a continuation to that one. So if you remember, you were not having this condition in the first place. So if you are having it now, it means there's something wrong. You must have been doing the wrong thing. So that's why you are now in the rabbit hole, as I would say. And I am more than happy to solve the problem by providing you the right solution. So we can tackle these pathologies in so many ways. The first one is lifestyle medicine. When I say lifestyle medicine, it is kind of using plants or other things around you. You don't really need to go to anywhere or say get anything synthetic. You might want to do that. You might want to combine it, provided your doctor is okay. And there's another thing I want to let you know, that it is not a quick fix when it comes to lifestyle medicine. It's a gradual procedure and you have to do it on a regular basis. It's not as if you do it for 1 week and you expect to see the result. It doesn't work that way. So we will go straight to what we have to do. We are so blessed to have quality food in Africa. They are not synthetic. I know there are some shops in Africa right now where you can get canned food like what we have here in North America. But again, I'm not here to say anything. It all depends on you. But if truly you want to cut down weight and also manage your diabetes, then what I'm going to say now is ideal. If you look at the photo, or what they call thumbnail image on this clip, you will see there that there is a bowl with gari in there, lobsters, crabs, okra, and the liquid stuff is just a few drops of coconut oil, which is used for spicing. Then there's ginger, there's garlic, there's onion. All these things that I've listed, they play a key role in metabolism. They have a lot to do with your pancreas. So when you are putting on so much weight, it is because the pancreas is not working the right way as well as your liver. Your liver also has been taken hostage by fat. You've put on so much weight. So that's why we now choose to design this plate this way. It's a kind of burner. That's to burn down that fat that has engulfed these life-saving organs. So when it comes to the management of diabetes and overweight or pre-diabetic patient, the first thing is for us to do what we call insulin sensitivity. How sensitive is your insulin is a key factor here. And the only way to do that is by introducing food that could help to burn down that fat and then increase the insulin sensitivity. So meaning that your heat to waist ratio needs to be controlled. That it should be less than 1. Whether you're a man or you're a woman, it should be less than 1. Your abdominal circumferences has to be reduced, some physical activity, all those things need to be put in order. And I will tell you what to do. So for physical activity, you don't really need to go outside and do a marathon. Because I know some people will tell me, oh, my knees are paining me, I cannot go outside. That's fine. The key thing is being active. So you can even do some basic exercise in your house, even within your own bedroom, by getting up in the morning and move from the room to the kitchen by tiptoeing. When you tiptoe, you stimulate the 2 muscles on your legs. When you stimulate the 2 muscles on your legs, it goes a long way by absorbing that sugar building up in your blood and also the fat that is building up, what we call hypertrophy. So when you do that, the muscles now regain back themselves, so they become hypertrophies, like I said in one of my videos, and you are no more in hypertrophy or atrophy. That's why I insist on exercise. Now, looking at gari. Gari has what we call resistant starch. Remember in one video, I talked about types of starches. And I did mention that I will come to talk about gari. So gari is a special meal. Special meal in the sense that it has less to do with what we call glycemic load. Remember, there was a video that I talked of glycemic load and glycemic index. Every food has its glycemic index and glycemic load. So meaning that it tells you how that food can push your blood sugar level to what you never expected. That is, make you become pro-diabetic. So that's why I talked about this again. And gari falls in the table of what I call the green list. Remember, I did mention that there are 3 lists here. If you don't have it, please get back to me and see how you can get one. It's very important. You need that in your wallet. So the green list are the food that have low glycemic indices, and you can eat them as much as you can, provided you have no trouble with your kidney, because green leafy vegetable comes with oxalate. So there are 2 things here now. They are highly loaded with nitric oxide and also have oxalates. So if you are suffering from gout, then we need to readjust your dose. If you don't have gout, then that's fine. You can take as much as you can, because this nitric oxide serves as a vasodilator. So it's even a good meal for someone who also suffers from erectile dysfunction. Because if you have erectile dysfunction, you suffer from what we call endothelial dysfunction, meaning that blood is not flowing well. There's kind of clogging. So you need something to clear it. And nitric oxide is a good scavenger, so it does that. So gari has a resistant starch, meaning that you can eat gari and the next 6-8 hours your blood sugar level won't spike. That is a beautiful thing because of that resistant starch. Now, coming back to lobsters. Lobsters are highly loaded with chitosan. So those chitosan are very good for women, especially those that are developing what we call love handles. Love handles or pouches are those fleshy parts around your tummy, the side of your tummy, what we call your flank. You see some women, they have something like bubble around their flank. We call them love handles. Then their tummy is kind of protruding in front, and we call that one pouch or porch. So if you want those pouches and the love handles to go away, then you need seafood, and seafood here are lobsters and crabs. So the lobsters and crabs are loaded with chitosan. So the chitosans now, they have poor absorption. So those love handles now will definitely go away when you keep living on such diet. Now the next one is okra. Okra does what? Okra, other than having the nitric oxide, it also has another substance they call micelle or mycilage. So that mycilage now, when you grind it and you take this thing either in solution or call it, if it is in your food, it should be half cooked, not overcooked. When it is half cooked, it quickly forms what we call the micelles or the mucilage. That mucilage now in your blood helps to create what they call surface tension by absorbing the cholesterol as well as sugar. So the sugar that is building up in you, the okra absorbs it and then take it out through your stool. So please listen to this video very well and understand the mechanism why I'm insisting that your okra should be half cooked. When it's half cooked, it's beautiful because you conserve all the chemical substances, and the okra works like medication. So when you chew it, you get that crunchy sound. That crunchy sound is a great news in the sense that it assures you that that okra is not damaged chemical. The chemical structures are still there. So as you are chewing it, you could get the crunchy sound. It goes down to your tummy and then help to absorb the excess sugar building up at the level of brush border of your intestines, and then pass it out now as a stool softener. So you see now, okra has multiple roles in your body. Other than bringing down your cholesterol value as well as your sugar value, it also helps to increase the volume of your stool. So we call them organic stool softener. So meaning that this diet is also great for someone who has constipation. When you are constipated, that's what you need in order to send out the stool. Otherwise, it takes you to a stage called stool impaction. Stool impaction is so painful because it reduces the quantity of oxygen going to the brain. Your tummy now produces excess waste gases that can render you impaired. So that's my message. Make sure you stool regularly, and what you need is just this diet. Another important component in this diet is ginger. I know you can't see it, but that liquid you can see in that bowl tells you that that's the spice, because I made it, so I know what is in there. Ginger is marvelous. It has so many chemical composition there. It helps for high blood pressure. it helps for high cholesterol, it helps for high blood sugar value. It contains mineral also. Those who have menstrual pain, those who have body pain, those who have arthritis, all sorts of things, you find it there. So ginger is there, there's garlic, and there's onion. So you see that soupy substance you see in that plate has a lot to do with not only diabetes or pre-diabetic patients, but also those with high blood pressure, those with cholesterol. And remember, diabetes and high blood pressure, they go in hand. So when you have one, you definitely have the other one. And diabetes, looking at it, it comes with so many other diseases. So we want to make sure that you are not diabetic, because when you get to that stage and it is not controlled, you will blame yourself for not doing that. So if you are having waist to hip ratio greater than 1, I would say go and do HbA1c. Even if you are not a patient with diabetes, you still have to go and do that value HbA1c and bring it to me to analyze it, and things should be fine. I don't want anyone listening to this, my clip, to become a patient with diabetes. Diabetes is something that can be reversed totally. You may not need medication. You just need to be active. And when I talk about active here, is just basic brisk walking for 30 minutes every day, not 1 hour. A day has 24 hours, and I'm asking you to use just 30 minutes of that 24 hours. So you can see now, you don't really need so much to do to slow diabetes progression. Lots of people in the whole world are pre-diabetic and they don't even know that. They only discover it only when it is overt, that's full-blown, which might be kind of too late. So I'm here with this video now and this type of food to guide you. So it's a magic meal. It's a holy grail, as I will call it, because it's not meant only for one illness, but for multiple illness. It's a versatile meal, as I will call it. It is quite cheap. There's nothing synthetic, or it's natural. You can do it yourself. So why not engage yourself in doing this than running to supermarket to get canned food that contains conservant inside that will destroy your stomach and create what we call leaky guts. So that is my message for you, and I just want again to reiterate what I've just said before, that gari has resistant starch. That's why it is so important. It has little or nothing to do with blood sugar spike. It has little or nothing to do with your pancreas. It does not irritate your pancreas. So your insulin sensitivity gets improved. Lobsters and crabs are all loaded with what we call chitosan. The chitosan now helps to absorb the fat around the love handles of women and the pouches. The ginger plays the role for erectile dysfunction. I can assure you that if you live on this meal, you don't need Viagra anytime. You might not see the result right away, but I assure you that within a couple of months, you will see the magic. Garlic, it goes a long way to bring down your blood pressure. Onion does same in bringing down the blood pressure. Salt, I know somebody will ask me if they can put some salt in the meal. Well, I will tell you no. Forget about salt and just eat it that way. The coconut oil. Coconut oil plays a long way to do with your brain. It has a particular substance inside. If you remember, I did explain it in one of my videos, the role of coconut oil. So that's what you need in your meal. So you add coconut oil there to prepare this meal, and then you make sure that you consume it the way you like. You can consume it any time of the day. I would say morning should be ideal. Lunch also. For dinner, I would say take it not too close to bedtime. Another thing that you have to avoid is rice. Do not take rice for dinner. It's very dangerous because rice has a different glycemic index that can spike your blood sugar value. So that's why this my meal is recommended for you to take them in the place of dinner. So your rice can be consumed in the morning or at lunch. But for dinner, no rice. Instead, go with this one. So far, so good. My name is Dr. Wan. Please feel free to contact me. Feel free to ask as many questions as you can. The more questions you ask, the more you understand why this meal is being made that way. And that's it. Thank you so much and have a wonderful day. Share my links with anyone you like. Thank you. Ciao.